Can you hear me okay? Okay. So I am very excited to be here because I came from upstate New York and it was about 10 degrees for the last week. So this feels very comfortable to me. Okay. This feels really wonderful to be here. Is that better? Yeah, okay. So I'm here to talk about the thyroid and its impact on women's health today. About 22 years ago, I went through a period of chronic fatigue, adrenal burnout, and very early perimenopause. And it was due to all the overs that Dr. Darcy talked about, right? Overextension, overwork, significant stressors in my life. I sought out some very good integrative health practitioners, worked very hard on myself, and righted the ship. And one of those health practitioners was a woman who at that time had been in practice for over 50 years and said to me that it was her belief that women, about 80% of women suffered from some subclinical hypothyroidism at some point in their life. And I thought, 80%, wow, that's a wow factor. That's a lot. So subclinical hypothyroidism was kind of like a buzzword about 20 years ago. Women had a lot of signs and symptoms of hypothyroidism. They knew it. They went to their physicians. They got lab work. And what happened? Lab work was normal, right? We've all been there. We have family members, friends that have been there. So we had to dig deep and try to figure it out. What's really going on with our thyroid? Well, the thyroid is a very interesting gland. It's very small, about a ½ ounce to an ounce. It's twice as large in women, and it's very vascularized. All the blood in the body goes through the thyroid in about 18 minutes. So when I walk off stage, all the blood in our body will have gone through our thyroid. I find that also very interesting. The thyroid gland basically manufactures, stores thyroid hormone and releases it. And it's part of a very rich, complex web with the endocrine system. It is often called in relation to the hypothalamic pituitary adrenal thyroid axis. And if you could visualize 3 circles on top of each other with lines coming down, and the first circle being the hypothalamus releases thyroid releasing hormone, which then tells the pituitary to release thyroid stimulating hormone, which then goes to the thyroid gland and then takes iodine that's in the body on board, an enzyme called thyroid peroxidase enzyme, and then makes T4 and T3. 90% or so of this T4 then goes to the liver and has to be changed by an enzyme called 5-deiodinase enzyme into active T3. Now, active T3 is the only active metabolic thyroid that works at the receptor sites, helps with metabolism, and helps regenerate the body. We need to have T3 on board, and we need to measure T3. So there is a medical myth, a thyroid misconception in traditional medicine. And what it does is it leads to missing a very big picture in thyroid health. We need to see a total thyroid profile on ourselves. We cannot just look at the standard TSH and T4 that mostly is ordered when we go see whatever healthcare practitioner we're going to see. And we need to see TSH, total T4, free T3, and thyroid antibodies. Because if we don't, then we miss out on seeing the active T3, and we need to see that. Also, we miss out on seeing antibodies. Now, once antibodies are positive, we have a game changer. We no longer have classical hypothyroidism. We have Hashimoto's. And you need to look at both thyroid antibodies. You need to look at thyroid peroxidase and thyroid globulin antibody. Now, I'd say that this is probably the largest game changer in thyroid health because the statistics are that 27 million women have some type of thyroid disorder. 50% is probably undiagnosed, so that would jack that number much higher, right? Of that, 70 to 90%, based on who you get your research from, is Hashimoto's. Hashimoto's is an autoimmune disease. It creates inflammation at the gland, and the thyroid gland destroys itself. It creates antibodies and is destroying itself. The autoimmune thyroid, well, where does it come from? Really, it comes from when there is an immune system that starts to self-regulate. It's unable to self-regulate itself. It comes from when there are predisposing genes and certain specific triggers. So what are the triggers that predispose Hashimoto's? The triggers that are known today are heavy metals, chemicals, gluten, strong fluctuations in hormones, and then on board having gut dysbiosis, liver detoxification, food intolerances, etc. The important thing is to know you need to identify your triggers. You need to do whatever testing you need to do to identify the heavy metals with urine or saliva, or not saliva, urine or serum. You need to be doing genetic testing to rule in gluten intolerance or sensitivity. There are wonderful tests out there to look at the circadian rhythm of cortisol to address adrenal health. We can look at fluctuating female hormones now with saliva in a very interesting way. So we need to identify our triggers so that we can manage our thyroid dysfunction. In my practice, I see two triggers that are very common. And I work with one being amalgam fillings, right, mercury. Mercury is a neurotoxin. It travels through neural pathways. It destroys, it has a toxic effect at every cell in the body, very much the brain, and I believe the thyroid. And I believe this because when mercury fillings get to be of a certain age, they off-gas and vaporize. There's microscopic cracks in them. And the cracks come from chewing, and the cracks come from extreme hot and cold beverages. So just drinking a very hot beverage with a cracked amalgam filling will release vapors. If you want to see this, you could download on YouTube The Smoking Tooth, which is a video which shows technology that shows the vapors releasing while you chew. So it's interesting and also kind of frightening, you know? Especially if you have a mouthful of amalgam. My mouth is very dry here. So I work with a biological dentist on detoxifying patients prior to getting their amalgams out. And I can tell you with great news is that looking at pre and post testing, when women get their amalgams out, not only does subjectively their thyroid function improve, but their thyroid actually can improve on labs. And I think the proximity of the thyroid to the mouth is very important here, because as these vapors are vaporizing, right, and off-gassing, they're very attracted to this very vascular thyroid gland. And it's very important if you have Hashimoto's or if you suspect you may have Hashimoto's to get antibody testing and to get your amalgams out. The second is diet. I just want to speak about gluten. There's a huge body of research out there, very good evidence-based research that gluten affects the thyroid. There seems to be some type of molecular mimicry in which the gliadin protein mimics thyroid hormone at the receptor site. The thyroid gland recognizes that this gliadin protein is not thyroid hormone, and it sets up an antibody response to it, thereby destroying its own thyroid tissue. So I think that if one has Hashimoto's and has not had a genetic gluten sensitivity test done, they should do that. Because I think many women suffer unnecessarily because they don't understand the triggers. And understanding your triggers, getting testing for your triggers, you can manage your disease. There are good days and bad days, and this is for any autoimmune disorder, right? Whether it's lupus or some polyarthralgia or whatever. You're really having a bad day and you don't know why, but if you understand these triggers and you can backtrack and realize that you went out for pasta the night before and then you woke up and you had a bagel and, you know, on and on it goes, you can really identify them and not suffer as much. The thyroid in relationship to female hormones I find very interesting. In pregnancy, for instance, the body is already going through huge shifts in the immune system and the hormonal system. And the hormonal system is like a teeter-totter, in which there's one side is Th1 dominant and the other side is Th2 dominant. And they have to stay in balance. Well, in pregnancy, Th3 is modulated, it is Th2 dominant. And then postpartum is Th1 dominant. So this kind of polarized immune system is strong enough to tip the body, the physiological body, into having a Hashimoto's attack. So this is a good example where very strong fluctuations of hormones have an effect on Hashimoto's. So this is especially true for women who have kind of pre-existing triggers. women who have food intolerances and gut dysbiosis and food allergies and blood sugar dysregulation. It's very hard to get hormones under control with large circulating blood sugar imbalances in the body. And many people, many women go through periods of hypoglycemic just from not eating enough and not eating every 3 hours, etc. So this is an example of how their immune system gets tipped and how it affects the thyroid. During perimenopause and menopause, you have this interesting relationship of this hypothalamic pituitary adrenal axis. Because in perimenopause, we have our hormones are shifting, right? It tends to be a time of relative estrogen dominance and low progesterone. And the estrogen dominance is interesting because in the body, thyroid hormone is carried by a binding globulin, thyroid binding globulin. And that thyroid binding globulin has the capacity to also bind estrogen. So if there is too much estrogen in the system, whether you're taking in too much estrogen, whether it's birth control pill, Premarin, or HRT, or your body is not metabolizing your own estrogens and they're circulating, or xenoestrogens from the environment, whatever the reason, there's too much estrogen on board, that estrogen can thereby bind that receptor site and deprive the thyroid of its own hormone. So in perimenopause and menopause, this is one way in which the thyroid gland can be functioning subpar because it's not getting enough thyroid hormone from the estrogen dominance. Progesterone is very important because progesterone relative to the estrogen dominance would make progesterone lower. And progesterone's, one of its roles is to make the thyroid receptor more sensitive. It also helps make thyroid peroxidase enzyme. And thyroid peroxidase enzyme is in the thyroid gland. It helps make T4 and T3. And without enough T4 and T3, then we end up not going to the liver and making active T3, which are our metabolic T3. The progesterone, it's kind of a win-win situation because active T4 and T3, having more of it in the system will actually make the progesterone receptor site more active and potentialize that receptor site. So progesterone and thyroid have a really unique relationship. So we're having your hormones balanced as best as can through perimenopause will really serve your thyroid gland. And also looking at a full parameter for your thyroid gland will also serve going into perimenopause and menopause. And I mean, I think that every woman is in the business of preserving their brain, and unregulated thyroid disorder and dysfunction contributes to brain degeneration. There is a unique relationship in the brain, in the hypothalamus, between serotonin, estrogen, and thyroid hormone. And it's like when one of those is off, it pulls the others down. And if the T3 is very low, there's a lot of research out there that shows that serotonin levels go lower. And when T3 is in its optimal range, the highest end of optimal range, then serotonin levels are better in the brain. And serotonin is very important because if there's not enough serotonin on board, these feedback loops don't happen. And serotonin needs to be present enough for the anterior pituitary gland to be doing its function. The pituitary is what makes TSH. At any point in time in these conversions too, we need certain nutrients to make these loops function and happen. And in the liver, when the thyroid gland releases its T4 and T3, and the T4 goes to the liver needs an enzyme called 5-deiodinase enzyme. This enzyme is very zinc and selenium dependent. Zinc is very important for the thyroid because low antioxidant states have been shown to affect the thyroid gland, and selenium is a very needed mineral and antioxidant for the thyroid. So these lower states of thyroid function because of these enzymes don't allow the liver to then convert to make this active T3, and it feeds right back into this loop with serotonin and brain function and depression and mood and cognition because T3 is the only active receptor, thyroid hormone that works with receptor sites. It's really important to remember that. I personally think that the thyroid is very much related to, is very much affected by strong emotions and grief. And I think there's a physiological phenomenon with women that has no anatomical base whatsoever, and I think it's the lump in the throat. I remember as a young girl getting this. I don't get this as an adult woman, and I have a 15-year-old daughter, and I asked her and some of her friends, but I think that under periods of emotion that's not being expressed, whether it's anger, sadness, or not speaking our truth, we get this feeling of fullness or this lump in our throat, right? Well, there's really no lump in our throat. But I think it's the thyroid, and I think it's the thyroid's relationship and proximity to the throat chakra, which has to do with self-expression. So I think the thyroid's very tied in with speaking our truth. And I read some very interesting research on grief, and it was talking about grief being a time of an inward journey and a time of quieting down and really experiencing your grief. And it's a time in which the metabolism slows down. And so many women go into subclinical hypothyroidism during periods of grief. And many societies have these wonderful periods of grief set up where it's okay to be mourning for 3 months, 6 months, a year, right? Your behavior and what you're dressed, but we don't really have that. And so I wanted to mention that because I think that when women just can't get their act together or life together, and they want to go check their thyroid, if they're in a period of grief, they should really just acknowledge that, because we don't really want to medicalize the thyroid at that point. We just want to understand that the resting metabolic rate is suppressed. Everything's suppressed. It's like getting over the flu, right? You just need time, a couple weeks after, just to really rest. And so whatever it takes. So my takeaway here is that, I just want to say one more thing about the brain. Dopamine and serotonin are very important in the brain. Dopamine helps make more TPO, thyroid peroxidase enzyme, which then makes more T4 and T3. And serotonin has been shown to actually not only potentiate T3 for women who are depressed, but it also helps with women on SSRIs. So it actually potentiates the SSRI to work better when serotonin and T3 are on board together. My takeaway here that I really want to leave everybody with is this emerging Hashimoto is an autoimmune disease. 1 out of 9 Americans are now diagnosed with some autoimmune disease. And it seems to be when there's one, there's another one under the surface, and sometimes up to 3. And there are some labs that are coming out that are going to do big panels of looking at these autoantibodies. That's going to be really helpful. But it's very important to identify the trigger, right? Identify the trigger so you can manage. I call it also 2 Ps, to prevent the progression and to promote the restoration of the gland. Because if we can identify our triggers, if we can try to take time to manage our thyroid, if we can realize that one size doesn't fit all, one dose doesn't fit all, it may be needing to try various types of thyroid medications before you get to the right one, to use nutraceuticals, botanicals, homeopathics, glandulars, whatever it takes to make your thyroid function better, to seek out really good health practitioners that are there to help you. And you can improve, you can stabilize, and you can sometimes restore your thyroid back to a normal state. Whether you are on medication or not medication, you can synergistically work with various things. But the thyroid is so important for your health and so important for women's hormonal health and neurotransmitter health. So thank you.